Hello, I'm Jamie Lee Salgatar, and welcome to This Week in MedIT, your source for medical technology news brought to you by C&G Technologies. Today, we have an exclusive interview with founding partner of Janssen Healthcare Innovation, Diego Morales. Janssen Healthcare Innovation recently announced their Connected Care Challenge that looks towards providing awards totaling $250,000 to inspire and nurture the best solutions to improve patient transitions from hospital to home. The Janssen Connected Care Challenge is looking for approaches that will improve the patient's transition from hospital to home. This challenge is designed to spur innovation and drive action towards achieving better care and better health at lower cost through continuous improvement. Greatness is achieved when we work together, and Janssen Healthcare Innovation is committed to playing a pivotal role in stimulating the marketplace of ideas.
Janssen Healthcare Innovation is a division that we started within the pharmaceutical group at Johnson & Johnson. And the goal of Janssen Healthcare Innovation is to develop the new businesses in the spaces of healthcare delivery. If you think about every industry, the way as a consumer you experience different transactions in every industry around banking, around entertainment, around travel, around real estate, around communications. If you think how we did it 20 years ago and how we do it now, they are dramatically different. Well, the same thing is about to happen to healthcare now. The experience that we're going to have as a consumer is going to be very different, and it's going to be aided significantly by technology, by the use of technology in healthcare. So that's creating what we call emerging markets of healthcare, new economic spaces that did not exist before. One is around healthcare delivery. Everything around how does that consumer interact with and receive healthcare much better than they did before. I mean, one of those particular spaces within that healthcare delivery is mobility. In the past, you needed a physical presence to have an interaction with the healthcare system. Now through mobility, that interaction can happen anywhere a consumer is, and that opens a dramatic number of opportunities to create new business and new ways of improving healthcare. Another large space is around the new financing models of healthcare. And there's a lot of experiment going on in the world around how do you align incentives. Right now, as a consumer, I want to be healthy. If I'm healthy, the way that things are set up in the system today, the system doesn't make any money. Okay, so the system does not benefit from my health. The system benefits from my disease. All right, so you can see how the incentives are totally misaligned. The system should be rewarded for my health as much as I want it, and we have to design the systems that have those two goals aligned. And there's a lot of experiments going on to achieve that, and that definitely is going to be a huge progress for the healthcare systems. And the third space is around maintenance of health. Today, nobody pays you to stay healthy because there's no model. There's no money in health today, the way the systems are set up. That's why there are no businesses of maintenance of health. All the businesses are around treatment of disease. But in a world that aligns incentive, and me as a payer or as a provider, I'm rewarded for your health and not by your disease, then for me it would be really interested in figuring out how to help maintain your health. And then that day, maintenance of health is going to be a big business. Perhaps even a bigger business than treatment, because I mean the best dollar or euro spent is in keeping you healthy, not in treating your condition. So we strongly believe that maintenance of health is an evolving space that is going to be really large. And we want to make sure that Johnson & Johnson is an active participant and a leader in these spaces, because at the end of the day, we want to make sure that the consumer has the best possible experience in healthcare that leads to improved outcomes. And therefore, we think that that is an important role for us to play. We picked that transition, the transition from the hospital to the home, and trying to stimulate people, innovators, to come up with ideas about how can we improve that patient experience, the transition from the hospital to the home. So in collaboration with Health and Human Services, we put out a challenge to innovators and encouraging and incenting innovators to come up with ideas about how can we better do that transition through technology. The world is full of ideas, And the most important thing is not the idea, but how to execute them. And that's what we're looking for people that help us understand how to execute those ideas and make them into something tangible that makes a difference to patients. So you can go into the Janssen Healthcare Innovation website, which is www.janssenhealthcareinnovation.com, and look in the website around the Connected Care Challenge. And then that's all the information on how to apply and submit the application.
We are very honored to be participating in today's Care Innovation Summit. My name is Kimberly Park, and I'm part of a new entrepreneurial team within Janssen Healthcare Innovation and part of the Johnson & Johnson companies. And I'm really pleased to be here today to announce the Janssen Innovation Challenge for the space of connected care.
Today we are here to announce the Janssen Connected Care Challenge. This challenge really seeks to find a solution, technology-enabled, that will help the patient when they transition from the hospital back to their home.
If you've ever experienced a challenge yourself and had to be hospitalized or cared for a loved one, you know it's a very difficult situation to try and coordinate their care. The primary care physician may not even know the person's in the hospital. They may not even know that that patient's been discharged. And there are various physicians that are involved, different specialties, different medications. Coordinating that care, particularly after they leave the hospital, is incredibly difficult. So we want to help people understand that there's a better way to do this. And that's really the heart of this challenge. Can we develop a tool, a system that will help people manage much more effectively?
I'm very passionate about the connected care space because my father had a stroke. And my brother and I had to go help him actually manage through the process of leaving the hospital and going to his home. It wasn't easy. We worked with different physician specialties, different medications, his rehabilitation, and we thought, wouldn't it be nice if there was a very simple tool that would help either the patient or their caregiver connect all of these different needs of the patient as they transition from the hospital back to their home.
Now, fortunately, my dad is doing really well today. He's playing tennis, he's reading the Wall Street Journal, so we're very lucky. But a sophisticated tool that would have helped us manage his care throughout the process would have been very valuable. In fact, that tool would be valuable to us today. But honestly, what's more important are for the millions of people who have no way to take on this care management process themselves. He was fortunate he has 2 loving children who wanted to do it on his behalf, but not everybody is in that same situation. With this crowdsourcing innovation challenge, we are taking a significant step forward to spur innovation and collaboration. The Janssen Connected Care Challenge is looking for approaches that will empower the patient and their caregiver to successfully manage and optimize the recovery with accurate and timely connectivity across all points of care.
Individuals submit their ideas between February 27th and March 25th. There will be a group of people who review those submissions, and then we'll bring together an expert panel, and they will review the submissions, select 3 winners. Each of those winners actually receives $50,000. Those 3 individuals will then be helped in terms of developing their business model and further developing the concept. When they do that, 1 winner will be selected. That person will receive $100,000 and help in actually implementing that idea with a healthcare delivery system.
The reason that this problem is so important is because the amount of spend that takes place in this space. And it's driven by the fact that 1 in 3 people who are discharged back into the community do not see their physician within 30 days. And they are the single biggest driver of the cost of readmissions back into the hospital. In fact, this is a $15 billion with a B problem. And the thought is that $12 billion of this could be prevented if care was coordinated in a much more systemic fashion.
We're really excited about this Connected Care Innovation Challenge because it's one piece of a larger part of how J&J and Janssen Healthcare Innovation is really trying to drive the change in the healthcare system. We're focused on the emerging markets of healthcare. There's 3 spaces in particular: optimizing healthcare delivery, innovative financing of healthcare, and the maintenance of health that we think hold great promise for the future. Not only for the individual patient, which is the first part of our credo, but also for healthcare providers and everyone else who's involved in the healthcare delivery system.
That's it for this edition of This Week in MedIT for the week of March 14th, 2012. If you want to be featured on This Week in MedIT, email us at news@thisweekinmedit.tv. I am Jamie Lee Salgatar. Have a great week.